Welcome to the Yoga Therapy Hour podcast with Amy Wheeler. I've had the good fortune to travel the world learning about yoga therapy on a global scale, and I've been able to meet many of the leaders in the field along the way. I want to share with you what I'm learning as I interview our colleagues from around the world. My hope is that together we can reduce suffering of all sentient beings through our work as yoga teachers and yoga therapists. I am so excited about our topic today with Melissa Sue Ogden, who is talking to us about PMDD, which basically means that when you have your menstrual cycle, going into it and during it, and maybe even around ovulation time, you are just completely taken out. Many women, as we're going to hear from Melissa, really have a hard time during this time of the month. And the reason I'm so excited about this topic is because when I was 15 years old, I was running track and field, and I had what I think is PMDD. Of course, we didn't have a name for it back then, 45 years ago. We didn't have treatments for it. We certainly didn't have yoga therapy as a way to deal with it. So what they did with most women at that time was put us on the birth control pill to try to regulate our hormones, to try to regulate our cycle. But there was never any lifestyle medicine information. They didn't tell me what to eat. They didn't tell me that when I ran 9 miles, it was going to feel worse. They didn't tell me to get good rest. They didn't give me yoga postures and breathing exercises and meditation that I could do to kind of come home to myself and take good care of myself. None of that. It was basically just, let's give these ladies some pills and see if that works. And so, Melissa came to us at Optimal State through our business course that we do every year starting in May. And it was a 6-month business course, but we've expanded it to 11 months now because we realized that's how long it takes to build a proper business. And Melissa was just a superstar. She knew right away that her life experience of having PMDD was something the world needed to know about. The ways that she had discovered helping herself through these very difficult moments and realizing that she had something super valuable to offer to help other people through their PMDD. So in our business course, she took off and running. She is a marketing genius, as you might see in the interview today. And she knows her stuff. She knows how to help women with PMDD. So I am just thrilled to introduce you to her. I know her well because she's been in our courses. I think she might even take our entire yoga therapy course, although she is already an expert in helping women with these issues. I think she might be looking at the entire 800-hour plus course for yoga therapy. And we will be so happy to have her. She's a solid human, an empathetic, wonderful woman. She has everything together, and I think she'll be a great yoga therapist. So I introduced to you Melissa Sue Ogden, and let's get into it. Good morning. I am so excited and thrilled to introduce you to my friend, my colleague, Melissa Sue Ogden. And first, I just want to congratulate you because it's only been in the last few weeks that you've changed your name to Melissa Sue Ogden from Melissa Sue Vair. So what happened in the last few weeks that you have a new name?
My husband and I eloped. Couldn't stand not being married anymore.
I love that. I love eloping. My husband and I think I told you we did the same. And then later we had the party with the family. Is that what you did also?
Yeah. So we actually got married in this room, like right where I am right now. And, we just did it kind of like on the fly wonderfully. And then we did have a little celebration with our family in the Outer Banks of North Carolina. And then hopefully we will also have like a big reception with dancing and lots of friends, as hopefully COVID settles down eventually as things get safer. But we've got family scattered all over and friends scattered all over. So it's hard to kind of pin down when that would be.
It might be your 3-year anniversary.
Exactly. 5 years, 10 years, whatever it takes.
Well, I'm really so happy for you. I know that you have a deep love with your husband. It just kind of bursts out of all the pictures, and
Thank you.
it was nice to a lot of people complain about Facebook, but I personally love it because seeing the pictures of your wedding in that room, in that corner, the two of you holding hands, looking at each other, like I would have never gotten to be part of your life in that way if it weren't for the pictures on Facebook. So I'm always thrilled for Facebook.
Thank you. Yeah, me too.
So today we're going to be talking about yoga therapy and therapeutic yoga. We could even talk about the crossover there for something called PMDD, premenstrual dysphoric disorder. And you are an expert in this area because you yourself have experienced this. I'm not sure how long. I'd love to kind of hear your story, but sure. What you write is, I teach menstruators with PMDD how to persevere using yoga. From one PMDD warrior to another, I offer accessible therapeutic yoga practices for managing PMDD symptoms, and I help folks feel like themselves all month long. So let's start with your story. How did you come to want to share this with the world?
Well, so I have been a yoga teacher since early 2012. And for the longest time, I taught yoga for everybody else. I tried to teach yoga for everybody. That was the thing that was really important to me, to make yoga accessible and to be available to teach whoever may be interested in the practice. And I feel like I did that very successfully for a while, having a yoga community in a space that had a wide range of classes and a wide range of teachers. But eventually it came time for me to move on from that. And for a little while, I worked in like a regular small business environment and found that I absolutely hated it and could not do that. And part of the reason was because when I was teaching yoga, I was much better at managing my PMDD symptoms. When I went into a kind of regular business environment where I was expected to work normal hours on someone else's schedule, I found that I could no longer manage my PMDD symptoms. So I took my time trying to figure out how to transition and decided to leave my job, my well-paying job, right at the onset of the pandemic, which of course at the time I did not know that the pandemic was coming. So I kind of just got sidelined with what my plans were to just return to teaching normal yoga again, to just go back to studios being a yoga teacher for all. And so with the onset of the pandemic and that time to be home to really focus on the management of my own PMDD symptoms, I realized that the time was actually ripe and available to start teaching people like me, people who have PMDD, who can benefit from the therapeutic yoga practices that I kind of took for granted that I knew, but I had taken almost a decade to develop these skills and to apply them to myself first and foremost. And of course, I have not healed my PMDD. I have not totally changed my experience in the luteal phase of my menstrual cycle, but I do have a skill set of perseverance and resilience that I want to help others cultivate, and I want others to feel empowered by. So I made this shift with a lot of credit to you, Amy, by taking your professional development course. It helped me to understand that my yoga business was an extension of who I am as a person, that it was an extension of my yoga practice, and that need to try to take care of other people that was actually taking something from me that I needed to give myself first and foremost. I needed to make sure that the practice that I was sharing outwardly, I was also receiving inwardly. And so yoga for PMDD allows me to do all of those things for myself, but also be able to serve a population that greatly will benefit from these therapeutic yoga services. And I think that it's just that the time is so perfect in the field of yoga specifically as well.
One of the things you just said that I think is true for PMDD, for pretty much any chronic illness like chronic pain or autoimmune disease, is this inability for us to go out into the normal world and have all of our senses drawn outward, our mind drawn outward, our attention, our energy, our focus. Everything is going out, out, out. And when we get in those 9 to 5 work environments and expectations and intensity, it's true. It's really, really hard to manage a chronic illness. And as you are saying, PMDD. And I think there's so many people out there that are in that situation that want to make that shift that you were brave enough to jump in and make and say, look, my health, my life is more important than this job. And I'm going to find a way to make a business around what I've learned, and then have the faith and confidence to do it. I mean, that's what I love about you is you just did it. You just decided one day, this is what I'm doing. And you worked your butt off to make this happen for yourself. I think of anybody in our professional business development course, like you just took it and you ran. There was so much shraddha, so much faith in you. And that's what it takes. We can't lollygag around and be like, I don't know, maybe I shouldn't. No, if you're going to do this, you have to dive into the deep end of the pool and just go. So yeah, what do you think?
Well, honestly, I have to partially give credit to PMDD for that, because with that type of chronic illness, I go through my own personal hell essentially every 2 weeks. And for the longest time, it was something that I was secretive about. I was ashamed of. I felt like I was out of control and it made me less than. And I lived in that sort of belief about myself for long enough and cracked through with the yoga practice, where I started to really develop a sense of having a purpose beyond kind of this temporal body of mine, and having a connection to something much greater than myself. And I have to hold on to that each month, because the luteal phase, essentially one of the symptoms for me with PMDD is like nightmarish type intrusive thoughts, having, a deep questioning of who I am, what I'm doing, whether or not I belong, if I'm secure. It's essentially the nervous system responding with a trauma response for almost 10 to 14 days out of my month, every month. And that's just one of the kind of emotional, psychological symptoms. There's also a slew of physical symptoms. So surviving myself every month with premenstrual dysphoric disorder, surviving the dysphoria of the disorder, it has sort of built this resilience inside of me. I have a lot of fire. I've survived a lot. And I think that is what makes me feel connected in my purpose, to know that I can empower other people, because I'm not just, pardon my French, I'm not just talking out my ass. I do actually live this. I know this. And, I come from an authentic place of just wanting others to feel more held as they go through the experience, to feel less alone, to feel empowered, and as though they have tools to face themselves, because I know that the worst demons are the ones kind of living between our own 2 ears.
Well, I want to hear all about the symptoms, because I think there's a lot of people that are going to be listening to this podcast that they themselves or their daughter or their niece or their aunt or their grandmother had this, but never had a name for it. And maybe even thought to themselves, do I have something, a mental illness? What's wrong with me? Why am I having these intrusive thoughts? Why do I have so much self-doubt? And may have not even tied it to the menstrual cycle and the luteal phase. So take us through, what are the main physical, mental, emotional, spiritual symptoms? And then when do they tend to arise? And what does that look like? Because I think we're going to find a whole lot of people that are going to say, oh my gosh, there's a name for what I've been experiencing.
Yeah, absolutely. And so I will say that is essentially how I first came to my diagnosis. One of my closest friends, she was diagnosed, and when she described her symptoms to me, it was like fireworks were going off in my mind. I was like, that's precisely what I'm experiencing. And so the important thing here is having some semblance of tracking of your menstrual cycle, because with premenstrual dysphoric disorder, we see a marked change in someone's personality, in someone's physical capacity, especially when it comes to like sleep or brain fog. Those things show up in the premenstrual phase. So the time between ovulation and menstruation, which we call the luteal phase. And so in an average 28-day cycle, most people ovulate between days 10 and 14 approximately. And so a lot of people start to experience symptoms around ovulation, and they continue all the way until menstruation. And it's not a hormone-based disorder. So it's not like your hormones are out of whack or you're having too much of one hormone and not enough of the other, anything like that. So it's not like you can have a blood test or a spit test or urine test or anything like that. The only way to diagnose it is to track symptoms and to see the symptoms arriving kind of regularly with that luteal phase of the cycle. And so there's a whole slew of symptoms. And interestingly enough, everybody's are kind of different. It seems to be that this mood-based disorder has something to do with the chemical response to hormones in the brain. And so symptoms can include things that are similar to withdrawal or having a severe cold. So you may have migraines, headaches, joint pain, light, sound, skin sensitivity. Hypersomnia or insomnia are frequent. You can kind of switch between the two, needing to sleep all the time and then not being able to sleep at all. And then there are gastrointestinal issues that can come as a part of it, where the body is basically having an extreme stress response and acting thusly. And so with the mind, there tends to be a correlation of irritability, worthlessness, depression, anxiety. And one of the kind of worst, most severe symptoms that a lot of people report is just suicidal ideation, feeling as though life has taken on this darkness and this lack of meaning. And so suddenly, too. I mean, the shift is sort of like you're fine one day and then you're not. And everything that you could sort of handle before, you suddenly cannot. And so if you don't know what's going on, it's quite scary. It can feel just, it's discombobulating. You suddenly don't feel like yourself. And a lot of people describe it as sort of like a Jekyll and Hyde experience, or like a kind of werewolf experience. Like you become this other being, this other monster version of yourself almost. And people find that they take it out on those around them. There's, difficulty in managing relationships and jobs, going to school. It's very disruptive. And these symptoms are debilitating for a lot of people. So it is almost like a uber version of PMS, of what we kind of think of as just, PMS is sort of a misogynistic joke of, we don't take people seriously because of it. But PMDD is like this extreme that it ruins people's lives. And there is an increased risk of suicide for people with PMDD. So it's not something to be taken lightly, especially if you think you may be experiencing those symptoms and experiencing that sort of an extreme shift.
Wow. That's really intense. I would imagine there's like a kind of a scale from mild to medium to severe also.
Certainly.
Anything else you want to say?
Yeah. So one of the things about PMDD that makes it kind of difficult and mysterious is that there really is no cure. We prescribe birth control that will stop you from ovulating. A period bleed is not a true menstrual cycle. It is what's called an anovulatory cycle. So you're not truly ovulating, therefore you're not going to have the hormonal shifts. Or if you are continuing to have a menstrual cycle, You can try SSRIs, which will help with some of the, thoughts, some of the more mind symptoms, but there is nothing that takes care of everything. And on the extreme end, people opt to have surgical or chemical menopause. Sometimes folks start with chemical and then are forced to turn to surgical. So a lot of people with PMDD have to choose between motherhood and premenstrual dysphoric disorder, or parenthood and premenstrual dysphoric disorder. And in my case specifically, I'm trying to conceive, and that makes premenstrual dysphoric disorder this other sort of weird ball game, because a lot of people do report that there are better symptoms, like that they feel better during pregnancy. But a lot of people also report that their PMDD symptoms become a lot worse after pregnancy, or pregnancy is the onset of their PMDD symptoms. So sometimes it feels a little like, just trying to figure it out, navigating this thing that we have so little education on. Becoming a person who talks about PMDD regularly means I also have to educate on the menstrual cycle, because we know so little about it. It's still taboo to talk about menstruation. And even though PMDD is not specifically tied to like the act of bleeding itself, it is important to understand, just the basics of the menstrual cycle and how that works.
I completely agree with you. I probably had a mild form of this when I was, age 15 to maybe 22, 24. What I remember about the education around my menstrual cycle, what could be more important than, your body is going to go through this big cycle every single month. As you said, 2 weeks of the 4, you may feel completely off, and yet it's taboo. We can't talk about it. And I remember, I was raised by my dad. I lived with my dad because my mom had left the family at that point. And I remember my whole talk about getting my period and my menstrual cycle and this thing that would be affecting me long-term was, Amy, honey, do you want to talk about it? This is my dad. Do you want to talk about it? And I think I looked at him and said, no. And that was the end of the conversation. And there was some pads delivered to me or something, but that was it. That was my education. And until I got into yoga and yoga therapy and Ayurveda, and really looked at the Vata Pitta Kapha stages of the menstrual cycle and what was happening and what the different colors of blood mean, and if it's scanty versus it's heavy versus it's brown or red or purple or clotty. I was like, in my 40s by that point. And I was like, why didn't somebody tell me this when I was 12?
Yeah.
Like this could have saved me, 20 plus years of total pain and heartache, at least to understand what was going on in my own body, right?
Truly.
So what do you think? You've been working with this, like you said, for over a decade. And even though you wouldn't say you are cured, but you are in process, actively managing it, giving yourself care to yourself and others. Mm-hmm. What do you think is like the most important mechanism? What is it that you've done for yourself and you help other people with? And you don't have to get into specifics because, we only have an hour, but really, what do you think you're doing that is helping women? Because I think in Western medicine, and then you've got yoga therapy over here or therapeutic yoga, like it's hard to help people bridge, like how could therapeutic yoga help with this PMDD? Like people need that bridge in their mind.
Yeah, absolutely. And I think, it's one of the things that I'm excited about, because I think that this bridge that we're building as yoga therapists is so desperately needed. In some sense, we need allopathic care to catch up with looking at people as whole beings and not just looking at treatment of physical symptoms. I think a lot of people with PMDD would tell you that the joint stuff, the physical stuff is fairly manageable. The bloating, like we have tools, we kind of know how to handle bloat a little bit. Not that it makes it any less uncomfortable when we're experiencing it as a symptom of PMDD, but we kind of know how to deal with that. how do we deal when our mind is trying to betray us and sabotaging us? And so having options of just like, well, you cannot have a cycle, or you can take an SSRI, or we can just remove those organs entirely or cease their function. Those aren't really options for everybody. Not if you're trying to conceive, not if you are, trying to have whatever your religious beliefs may be around using some of that stuff, just wherever you may be in your life, those may not be the best ways to go about that. And so with therapeutic yoga, treating people with PMDD through the lens of the five koshas, really looking at all of the different bodies and how PMDD affects those layers of our being, and understanding what we can do, using the tools of therapeutic yoga to affect each layer of that being, to give a person a sense of being wholly themselves. Because when we feel like we are kind of this two person, this like kind of binary being, there's like this kind of good us during follicular, when we feel kind of, energetic and we feel capable and we can make decisions. And then when we are in the luteal phase and we feel just kind of steamrolled, I mean, you kind of feel like you're one version of yourself sometimes, and then a shadow version of yourself the other times. And for me, it was really shifting my belief of I am my whole self that whole time. And by viewing myself kind of in these five different layers, and understanding myself as a physical being, an energetic being, an emotional being, a body of wisdom, and also connecting to that like highest sense of myself, made space for me to be both that shadow and that light. And to integrate myself, to not feel like, only the me that can produce is the good me, or only the me that is active is the good me, because there is a natural kind of monthly cycle. The moon goes through a natural monthly cycle. So many of us are trying to just live on a solar cycle, I think, this 24-hour, like, what can you do in a day? When people with PMDD, we really have to honor ourselves monthly. There is a monthly shift we go through. And I think this is true for all menstruators, but I think people who have premenstrual issues, because there is also premenstrual exacerbation, which is, it kind of is the amplification of pre-existing conditions. I think we're sort of the ones saying like, hey, like the current work cycle doesn't work for everyone. Like, the 5 days on, 2 days off on your schedule that's not going to fit for me. That's not necessarily how I'm going to be able to operate. So I think therapeutic yoga provides permission. It provides acceptance. It provides a place to really understand who we are in this experience that we're having, that can very easily just be looked at as like suffering. We could just feel totally sorry for ourselves. We could just throw our hands up and be a victim. And at times, trust me, I have done that. But I think with therapeutic yoga, we start to see that there are things that we can do with this knowledge, with even the knowledge of dysphoria. As uncomfortable as it may be, there's a strength that we can pull from this.
So I think that's one of the things I wanted to ask you about, premenstrual dysphoria disorders. Just define dysphoria for people around PMDD, just to get in our heads exactly what that means. You may have already said it, but let's link it.
Yeah, totally. So, I mean, we think of euphoria, right? So euphoria is a state of just feeling like ecstatic, feeling like whole and connected, and really in your being, kind of in your essence. Dysphoria is the opposite of that. It is feeling completely disconnected, ungrounded, unstable, just interrupted, disrooted. I mean, it feels as though your world falls away, your control over your body, your control over your mind. And then there is a piece of your spirit that has to do battle to say, my life is worthy. I mean, that is a traumatizing experience. A lot of people are traumatized just because of having PMDD, because of that dysphoria piece.
And I can see how that would spread into every area of your life. If you're feeling unworthy, if you're feeling possibly even like you're having suicidal ideations, if you're thinking I'm ruined, I'm not capable of having a stable relationship. I mean, this is a big deal. I can't work at a regular 9 to 5 job. All the messages that society tells us, you should do this, you should do that, don't match up with the needs of your 5 layers of the human system, as you said. And I'm thinking of this woman that I used to work with who clearly had PMDD. I didn't have a name for it back then. And she would be so amazing for half the month. And then she would turn into someone else the other half. And she was a coach. So her players didn't, and I don't even think she herself understood what was happening, but her players didn't know which version they were going to get. It was a really, really hard situation. And eventually, after she had her first child, she decided to have, surgery to remove her uterus. And she just said, I can't do this anymore. And so I don't know, does that help if someone just throws their hands up and says, I don't know what to do, I think I'll just have my uterus removed? Does that help at all? Or is it still there?
I think it's both. And I think that it is an option that drastically improves people's quality of life. I don't think, though, that it is, without its own issues, because we know that when you destabilize the pelvis in any way, I mean, the uterus it has kind of important keystone purpose, that there will be other issues long term that may have to be dealt with, that may be more physical, though, than emotional or psychological, or both, and again there. And so I know that people experience relief, but it's not entirely asymptomatic from then on, because hormone replacement therapy is necessary, because our hormones are necessary for our functioning. We can't just not have any. And so it's tricky. It's really tough. Supplementations can help. And, there is a better way to manage hormone therapy than there's ever been. I mean, we're getting better and better at this, but I think that there is still this widespread need for more research, more understanding, and hopefully more options, which I certainly hope that more people will consider options like therapeutic yoga as a practice that is co-collaborative with other forms of care. Because I will say that my students, my community of people who have PMDD, they also don't just have PMDD. A lot of them are also experiencing fibroids or endometriosis or adenomyosis. They are also recovering from, childbirth and not having proper pelvic floor health or restoration after childbirth. I mean, they've got other things going on. PMDD is the thing that maybe brings us all together. It's our common thing. But in general, people who menstruate, our health is not necessarily understood as well as it should be. And I think, there's room for our experiences when we make room in these communities, specifically like this.
There's so many things that you just said that I want to come back to, because I think it's so important, when we have the uterus removed. And it's not that that's a bad thing. Like you said, we are complementary care with Western allopathic medicine, but so many women that I've worked with don't realize that destabilization, that the uterus is in there kind of holding space. And when you take something like that out, other organs collapse down, prolapse, there's so many things that can then happen, right? And so all the more reason for working with someone like you to keep everything toned and healthy and not too tight, but still strong enough, all of that whole lower, what we call the Apanavayu region and the pelvic floor. So that's number one, that this may not solve all of your problems. And then the other thing that came to me is, if we start menstruating at age 12 and at age 42, we decide, I'm just going to have my uterus removed, I can't take this anymore. We've still got 30 years of what we call samskara on the mental, emotional, spiritual level. Removing a body part will not necessarily change those thoughts of unworthiness or what's wrong with me or how come I can't do what everybody else out there seems to be able to do. Like there's so many layers of healing that could happen, and just removal of a part. Even if someone decided to go that way, I still think it would be great if they worked with you to work through all those layers and have some understanding. Because I think, in yoga therapy, when we start to help people integrate the way you have the shadow side with the euphoric side, the dysphoric and the euphoric side, I think healing happens. There's like this recognition of, oh my gosh, that's what happened to me or is happening to me. And I have a little bit of control over this, maybe not total. And I can understand this. It's that landing in the understanding of, wow, oh, okay, I get it. That in and of itself helps us to kind of begin the process of healing. Do you want to say more about that?
Truly, I love that landing in understanding, because these folks who have PMDD that are part of my community, or who are hopefully learning and following from me in my various social media outlets, I see that there is just a certain happiness in having an experience described that you're like, oh, I relate to that. I think one of the things that I didn't realize initially would be a part of my work, but has become really important to it, is just giving a voice to this thing. Like having the opportunity to talk to you, who, I consider you like one of the pinnacles of what I hope to achieve, and to talk to you about my experience with PMDD, and to represent and have this kind of community behind me that I'm saying, like, this is what we're surviving each month. This is what we go through. I didn't quite realize how important that would be to me, to just try to wash away the taboo of it, and to say, like, I am not any less because this is a thing that I experience, and to release the shame of having a chronic illness, a cyclical chronic illness at that. And so I think, landing in that understanding, having that space to just see someone and say, oh, they see me, they hear me, they understand me. That, I think, is one of the things I have been so blessed to receive from the PMDD community in turn, because I have learned more about PMDD in the pursuit of understanding more about PMDD than I ever even knew possible. And I have been extremely fortunate to represent other PMDD people as a member of the International Association of Premenstrual Disorders, the IAPMD. They recently had a patient-led research virtual roundtable where myself and other panelists were able to talk as patient experts about the experience of PMDD. And so I think that there is this just amazing intersection right now of PMDD being better understood by Western allopathic medicine, and people wanting to have more options for how to deal with it and understand themselves and their life with it. So to just boil that down, I am so grateful to be able to share and talk about this.
Well, I hope that there's doctors, nurse practitioners, psychologists listening to you right now, because your work is 100% online. Even though you live near Atlanta, Georgia, you can be anywhere all over the world to help individuals or give talks or be an expert panelist. So anybody out there listening, I hope you will consider working with Melissa. I feel like you're a trailblazer in this area. I don't hear anybody else talking about this. And so, Melissa, what in 3 or 5 or 10 years, like in your wildest dreams, if everything unfolded for your career and your business and all that you want to share with the world, what would that look like? What would you be doing? Who would you be talking with? How many clients would you have? Would you be giving speeches? Would you have a membership community that's thriving? Like, have you thought about what it would look like to spread the word of PMDD?
Yeah, so in the future, I really hope that people can more easily receive a PMDD diagnosis. I hope that there is better information about the menstrual cycle in general, so that in schools where they traditionally had separated the boys and girls to, learn about what was going to happen through puberty, I hope that it's not separated. I hope that everybody learns about the menstrual cycle. And I hope that when they do, when people are starting to learn about it, that there is an educational component that helps to screen for things like premenstrual dysphoric disorder, so that at the onset of menarche, we are starting to, provide people tools to better live as a menstruating individual. And I hope that my role in that is by continuing to educate people, continuing to raise PMDD awareness and an increased consciousness about, this kind of, like, I'll say, lunar cycle that we go through, that the 24-hour day is not the only way to live, and it's not the only way to be. And I hope that for myself professionally, that I am able to continue to work with people all over the globe. I would be honored to kind of make that full shift to being a yoga therapist that is like the person for PMDD. I want to be able to help people wherever they are with whatever their symptoms experience may be. And truly, I would like to have written a book. I would really like to have, a better organized sense of like protocols for or practices that people can use for specific symptom management. And I would love to just continue to speak and to serve the PMDD community, and to just grow my membership, grow the community that is supporting one another in their management of PMDD and on their yoga journey as well. Because I know that, hopefully as we get this better sense of how to manage our PMDD, our yoga practice grows beyond that too. And we want to connect even deeper, because I know that's where it's taken me. I just want to grow and grow and grow in my understanding of how to live my yoga. So, I hope that people with PMDD may start because they're uncomfortable and they're dealing with this disorder, but that they continue to practice with me and stay with me because they see how yoga has changed their life and given them tools to be their best selves.
I think that's such an important point for any chronic illness, is that this is going to be a lifelong journey. It's not like, oh, we fix it and then you're fine and it's all good. All the self-care rituals, all of the self-compassion that's developed, all of the taking time to rest when your body needs a rest, all of the community building with other people who are also going through what you're going through, it's going to continue long term. And it's not a quick fix. And especially with any kind of chronic illness, it's going to come back as soon as we go back to our old ways of pushing and forcing and working too hard and eating the wrong foods and driving around too much and not getting enough sleep and being stressed out. It's going to come back. Like the Yoga Sutras say, it can go dormant, but that seed is still there. It's going to sprout back up. So I love what you're saying about staying with your community long-term to keep ourselves on track. And now, do you have a community? Is it on Patreon?
It is, yeah. So it's Yoga for PMDD on Patreon, and we are an international community. So we try to be very democratic. We vote on class times so that, sometimes it's better for the people on the Pacific coast. Sometimes it's better for our folks in the UK. Just kind of depends on where we land on the voting for that time period. But we vote also on class themes. So depending on where people are in their cycle and what their time may be like that week, we have different offerings of what may serve the community best at any time. Most recently, actually, I did a 4-part boundaries course, how to set boundaries as a person with PMDD. And we broke it down through the lens of the koshas. So understanding how to set physical boundaries for our physical body, how to set emotional boundaries, etc. And so
Beautiful.
we're doing the work in there, and the community is extremely supportive. It's been really, really fun. And honestly, I am so fortunate to have this community that is supporting me financially as their teacher, but also is supporting me so much emotionally in my own PMDD journey. So it really truly is a co-creative experience. I'm not just like, I'm the teacher and I will share everything I know. We are facilitating that space together because we all have learned something on our PMDD journey and we all have wisdom to share.
I am beaming over here because when I pictured our professional development course that we offer, this is what I pictured is someone who has life experience, authentic, real life experience, bringing communities together to share and care and be with one another. Like, to me, that is a sustainable business model. It's good for you. It's good for them. You don't have to choose between your health and making money. Like, it, to me, it's just the heart of what I want the yoga, therapeutic yoga and yoga therapy business or industry to be about. And you're doing it. I'm just so thrilled. All right.
You.
So
Thank you.
I also want to ask you, you are such a pioneer and someone who is so at the forefront of diversity, equity, inclusion, social justice. Tell us a little bit about that. How did you come to be so interested in that? And how does that connect to your idea of what yoga is?
Sure. Yeah. So I do have a bachelor's degree in women's studies, which women's studies was the title of it. But I feel like that's a little bit of a misnomer because it truly was more social justice studies. I studied critical race theory. I studied queer theory. And at the time, I was really concerned with racial equity. I actually wrote my senior thesis on white privilege. And, I happened to just be doing that in 2010, in a time before it was kind of, I hate to say it, but it's sort of become trendy now to sort of just say you're into that, but not really be doing the work. And so I had started understanding my intersectional privilege through the course of my bachelor's degree. And at that time, I was also starting to come into my own understanding of myself as a queer person, knowing that I'm not interested in maintaining some of the norms, especially the heteronormative kind of patriarchal norms that create this binary society that cast us into, specific sexes, that cast us into specific expectations, that shoulds on us. And so for me, my work as a yoga therapist has always included accessibility in terms of who is able to practice with me. If they come in a wheelchair, if they come in walking, if they come in with back pain, wherever they may be, I wanted to always be able to work with that individual. And because of my background as a feminist, it meant that my work also had to be inclusive, utterly inclusive, that it was not optional or, it wasn't supposed to just be trendy to make sure that whoever was in my space felt safe to be there. And so that includes using solely inclusive language. So you may have noticed that I only refer to people with PMDD because more than just women menstruate. And I think that if you were experiencing PMDD, it would be another enormous blow that I will do my damnedest to never land, to be misgendered or misidentified, or to have to deal with any gender dysphoria while you're also experiencing premenstrual dysphoria. The other thing that I think is really important about the work that I do is that I never ever talk about weight. I'm not a nutritionist, so it's a body neutral space. Like, it's not about having a specific size body, or I mean, so many people have told me that when they first went to their doctor with their PMDD symptoms, they were just told to lose weight. And so those sort of conversations, they stay safe. We make sure that the environment we're cultivating is one where everybody feels safe to be themselves and heard. So that means little things like requiring pronouns in our classes. We always share what our pronouns are, so we don't make any assumptions about anybody. And then also just using people first language when referring to our bodies, when referring to where to place props, for example, or talking about any of the systems of the body. We can talk about organs, but we don't necessarily have to gender them, because PMDD doesn't have a gender. Only the people who have PMDD do.
We could have an entire podcast on the last 3 minutes and unpack that. I don't even know where to begin. It was so juicy and so lovely. So let's just start with the prejudice around weight. So many people are told, oh, you have these terrible menstrual symptoms because you're overweight. If you just lose the weight, you'll be fine. And it's not true. Look at you. You're a very healthy, slender woman who lifts weights all the time and does pull-ups. I see you and your workouts, and there's no connection to having PMDD or not having PMDD, right? That's so important, that it's not just overweight people that have PMDD. And then I think we also need to unpack this idea that you just introduced, that it is gender neutral. PMDD needs to be gender neutral. And I remember when I first heard you say this, I thought to myself, wait a minute, it's about someone with a uterus, it's about someone with ovaries. And I don't know if I did it in class or if I went to you later, I said, I need to understand what you're saying. What I hear you saying is that a trans woman could have PMDD. And you really helped me unpack and understand that it's not about the genitals. It's not about the body parts. So can you unpack that for us just a little bit?
Yeah, certainly. And so what happens most of the time is that people confuse sex and gender. And so sex is what we tend to consider as like, the XX, XY. We tend to break it down to, penis, vagina. Like we have almost a very crude binary way of understanding sex. Gender is performative, though. Gender is how you live and present yourself to the world. It's a decision that you make yourself as to how you identify. And so gender isn't something that is, placed upon you. Sex can be placed upon you. Someone can assume, oh, you have a penis, therefore you are a male. Your sex is male. But someone can't look at you and say, oh, I know that that's a he based on how he dresses. Because clothes, again, don't have a gender. Only people have a gender. And so with gender being performative, that is why we have to make sure that when people are identifying their gender for themselves and making sure that they are being seen and understood as the person they are, that they're not kind of just pushed into this box of only being able to honor this part of themselves if they're able to kind of get rid of this other thing. So, I wouldn't want someone with PMDD to feel like they can only have access to yoga for PMDD if they understand themselves as a woman or, extremely relate to their body as being female. It's not a prerequisite.
I think so many people don't understand that all humans have monthly hormonal cycles. All humans go through menopause, andropause. This is not just a woman thing. Mm-hmm. It's all humans. And because certain humans bleed and then at some point stop bleeding, we think it's just those people that are going through the different cycles that could be hormonal, could be so many different cycles going on. So I think it's really important to recognize that. And I think one of the things you explained to me is that even someone who might be going through hormonal treatments, maybe a trans person, they're going to have these cycles happening whether they bleed or not. Can you say a little bit about that? Because I was so happy you were willing to walk through this with me so I could understand, because I think yoga therapy has the potential to be a safe space for healthcare when so many LGBTQIA plus people don't feel honored, don't feel safe, don't feel like certain healthcare professionals will accept them and honor them as they are. I think yoga therapy has great potential to be that safe space. Do you want to comment on that?
Yeah, I do. And I agree. I mean, I think that is one of the reasons I mean, I always knew that I would be a teacher and a healer. I became a yoga therapist because it allowed me to do all of those things together and to explore, my own development. And I think because, with having an inclusive space, with being different in any way from the social norm, and I say that with no judgment as to whether or not that's good or bad. I think that there is an opportunity here to be so much better than what the bare minimum is in society right now. And someone who is trans, someone who uses he, him pronouns, but has a uterus, may have had top surgery and no longer appears to be female bodied, but is dealing with PMDD symptoms because they are still experiencing a menstrual cycle, even though they may appear masculine. And that person needs support. They need a space and a community to have PMDD and understand how to empower themselves and persevere with that without judgment about being trans. I mean, that it really is of no importance. You just are who you are. Conversely, there are also people who have top surgery, who have double mastectomies, not because they're trans, but because they were at risk for breast cancer, or there was some other reason. And that individual may no longer have breasts and may be a menstruator, but may identify with pronouns she, her. And so there's just no point in assuming something that can be so easily shared. It takes zero effort to ask people to include their pronouns, to destigmatize sharing them, especially if you are someone who appears to be cisgender. Normalizing that you still share those pronouns is a signal to other people that you are safe. You are safe to have, to be yourself, to not hide any aspect of your identity. That's part of the reason I like using they as a pronoun for myself. I enjoy having a female body. As I mentioned, my partner and I were trying to conceive. I am enjoying, this existence as I am, but I also feel like I'm a lot more complicated than what is encapsulated in this idea of she. I don't like the binary, and falling into that non-binary category, being recognized as more complex outside of that heteronormative framework is important to me, especially because I benefit from thin privilege, from white privilege, from perceived cisgender privilege. So if I can disrupt that norm a little bit in the yoga therapy world, in the PMDD world, in my own communities, I feel like that's an integral to my work as a feminist, a yoga therapist, as a human being trying to elevate human consciousness.
I love everything you're saying. I've been noticing on the roll sheets for my college classes this semester that's starting in a few weeks, it has the pronouns listed now, that when the kids register for a class, they put in their pronouns. So I can actually accurately address them and honor them in a way that they want to be honored. Because as Stephen Ingram taught us a few weeks ago on the podcast, he was sharing with us on being trans and how yoga therapy can help trans people. The most important thing he said, and you just said it too, is the way that we are showing up on the outside may or may not match how we're feeling on the inside. And wouldn't it be a wonderful world if everyone could feel comfortable and safe to be in alignment on the outside and inside and not feel judged or unsafe in any way? And we have a lot of work to do in this area, a lot of work to do. And you saying, look, I want to disrupt. I want to use pronouns of they. This is important to me. If more of us were willing to be disruptors of this binary, false way of looking at human sexuality and gender, big things can happen. And maybe yoga therapists can be part of that change in the world. It's beautiful.
I hope so. Yeah, I see it. I love yoga. I love therapeutic yoga. I've already dedicated so much of my life to it. It is my lifelong career path. I know I've expressed this to you over and over again, Amy, that I'm never going to retire. I'm just going to teach yoga until my life ends because this is the purest thing that I've ever done. With all of my life experience, whatever I have stripped away from myself, I've always come back to this practice because I see it as this kind of ability to change the world. Like this, it can propel us forward into the future. And your work does that. And I'm honored to think that mine may do the same.
Well, it already is. And I have one last question before we tell people how they can find you and where they can find you and get involved with all that you're doing. I know just the little bit that I've talked to you, and you don't have to give any details, but you have really persevered in this life. You have had some deep, deep disappointments. You have had grieving. You have had unexpected events completely uproot your life and force you to figure out, okay, what the hell is next? How did you get through those difficult times, and how do you still get through those difficult times?
Well, I will go ahead and say that I cry a lot. And I say that to be sort of facetious, but also I sincerely cry a lot. I think that my body is like an A plus detoxer when it comes to shedding tears. And it used to be a thing I was very ashamed of because I'm somebody who cries when I'm happy. I cry when I'm angry. I cry when I'm sad, when I'm disappointed. But in all sincerity, I think that for me, I come from a line of people who are very strong. My parents, they sadly lost their first child when they were young. And I, grew up in a home where they were grieving and didn't necessarily know to call it grief. And I started to understand just how much they were working through and how amazing they really are as people, how strong internally they are. And so in 2017, my younger brother died suddenly, and it really gave me the opportunity to practice all of the things that I had seen my parents doing, to understand that my capacity to love so big and to be so emotionally invested into someone, to be so open-hearted, that those were all my superpowers, that my sensitivity and the things that I have been given as my own personal challenges to overcome in my life, that those end up revealing the truest parts of myself, and the parts of myself that I think are more worth cherishing than any title I've ever had, or, any certificate, or any, kind of like egotistical mark of my worth. It's been in the moments where, shit's been the most horrible. And, I have been able to remember, just to use my senses, to be present, to be in my body, to be in the space that I'm in, to enjoy the fact that I'm breathing, and to come really back to the yoga practice and the essence of the yoga practice, that I am a human being and not a human doing, that I have one opportunity to be here, to experience this, to love as enormously as I can. And in the end, as far as we can tell from like a physics perspective, everything comes to an end. There is no such thing as infinity as far as we can find. And that's on, like a scientific level. That's not just in a woo-woo way. So being just grateful for the fact that I even get to experience the challenges, experience the pain that I've gone through, that I've been able to love and to lose. So I think honestly, it comes back to my yoga practice. It comes back to the simplicity of the breath, and just my surrender to a higher being, that there is just experience to be had here. And I can let it be beautiful even in the suffering.
I just said something very similar to my husband this morning, that we have kind of a tough thing happening in our house for the next 8 weeks. And I said, honey, our self-care, our self-connection, our connection to one another, our ability to handle this difficult time as a family and not crumble, all rests on our ability to do our self-care. And if we don't take care of ourselves and come home to our own heart and love big and know that all things do come to an end. That's the natural cycle of creation, manifestation, dissolution. We're not going to make it. This is why we do our yoga, is times like this, and then knowing every single moment together that we have is so precious, because it is going to come to an end one way or another. So I think that's such a beautiful note for us to reflect on and contemplate. I'm just so appreciative that you brought that up.
Thank you. Thank you so much, Amy.
So I want the whole world to hear about you, to find you. I want everyone listening who knows a niece or a daughter or a transitioning human being or an aunt or anyone, because I think you deal with PMDD, but I think you, as you said, all these other things, pelvic floor things, infertility, pregnancy, like all the things that surround this also show up on your doorstep. So the techniques and the tools and the technologies and the connection and the community that you provide are going to help a lot of these types of similar issues, if you want to call it that. Ways of being is probably a better way to say it. What are you doing in the world? How can people find you? How can they connect with you? How can they be a part of this movement that you've started so bravely?
Oh, thank you. Well, so I am yoga for PMDD on pretty much everything. And so just yoga, FOR, PMDD. I'm on Instagram, especially. That's my preferred platform, I guess you could say. I'm also on TikTok. And on Facebook, you can find me at Yoga for PMDD, as well as a private Facebook group where we can have more discussions. It's a little bit more of a community environment. And then, of course, if you are interested in joining the Patreon community, there are weekly classes. As I said, we are a supportive community, and that is just patreon.com/yoga for PMDD. So if you look up Yoga for PMDD, you should ideally find me. You can also just email me at yogaforpmdd@gmail.com. And I would love to talk to anyone if you have questions about PMDD, how to track your cycle, what symptom tracking even looks like, anything. I'm here to support you if you think this might be something that you're dealing with.
And like I said, even psychologists, doctors, nurse practitioners, people who want complementary care for their clients. They're doing their end of it. And hey, I'm going to refer you to Melissa Sue Ogden, because I think she has a lot of support and help also. Can I ask a question about your Patreon site?
Sure, yeah, of course.
Is that something that if people cannot be there live every time, because maybe this month you've decided to serve the UK and it doesn't work for someone in Australia, are the classes up there to do asynchronous, meaning they can watch it on their own time?
Yes, absolutely. And so all of the videos that we have done in the membership stay available in the membership. So you can access those at any time. For any of my private students, I also build them out a personalized practice playlist so that they have, kind of a slew of resources to use. So depending on what sort of symptoms they may be working on, we can get even more specific and intentional that way. And with the Patreon community, there is the option to practice as like a student member where you do the classes. You can do them live or on your own time, asynchronously, as you say. I do also work with people privately, one-on-one, who want to address what their PMDD symptoms are directly. And then because I know my work is affecting those on social media, especially, who may not be necessarily ready to join the community to practice, but want to support my efforts, I do have just a kind of regular monthly donation to Yoga for PMDD to help raise PMDD awareness. And I do make donations to the IAPMD each month as a part of my income from that Patreon community.
I think that's so important, that maybe somebody listening isn't even experiencing PMDD, but they've heard about you and they want to support you. And please do it. Go to patreon.com and support Yoga for PMDD. I love that. And if people wanted to join your Yoga for PMDD, and that's capital PMDD, on Facebook. What does that group look like? What do you do in the private Facebook group?
So, to be totally candid, we haven't been super active lately. I've kind of taken a little bit of a step back on some of my social media stuff. But in that group, I share all of the social media posts as to what I'm doing in terms of raising PMDD awareness. So there'd be information about the recent virtual roundtable that I did as a member of the PMDD Community Coalition. There are also updates and blog posts. I was recently featured in a blog post on the IAPMD website, as well as things like our podcast today and any updates about kind of what we're doing, any courses that are coming up, information that's relevant to yoga for PMDD, as well as any community conversations that folks in the group may want to discuss.
I think, as we talk about in our professional business development course, having these breadcrumbs where people can just kind of dip their toe in. Maybe the first thing is listening to this podcast. And I think I'll find that Facebook group and read that blog that she wrote. And then I think I might actually want to try a class on Patreon. And wow, that was great. Now I want to get a personal practice. And, maybe one day, I'm just planting this, but maybe there'll be a PMDD retreat one day where people and folks can get together for a weekend or a week and really dive deep one day, right? So I love that you have kind of these breadcrumbs to start small, to explore, to get comfortable. And then as people feel more safe, they can move into deeper work with you. And I think it's great.
Thank you. Well, I feel like I learned a lot of this from you. I really followed your model. And honestly, the biggest shift for me was changing this idea of it being a business. I was not comfortable being a business person. I have a master's of public administration. Like I was in the nonprofit sector. I was in the self-employed sector. Like being a business person was an uncomfortable thing for me. Shifting to understanding that this is a part of my yoga practice, being available to my students is only possible if I'm brave enough to market myself and let people know I'm here and I want to help.
I love that. So many people come to us and say, I don't want to do the marketing. And I'm like, it's actually not marketing, it's sharing. It's sharing your experience. It's sharing your love. It's looking at your community and waking up and thinking, what can I do to be of service to humanity today? And in the special way that I was put here to serve, right? So I think if we can get our head around that, it doesn't seem like you're selling something, because you're truly not. You're sharing something. And as prana flows, when we give out and share, it's only natural that we will be sustained and also taken care of. So I want to wrap this up and just say, what would you like to tell our audience as your parting words? And if you want to close your eyes and just see what comes to you, or if you know what that is, you can just say it. But what is it that you want us to leave with today from your heart?
If you, upon hearing any of this, are suspicious that you may have PMDD or that someone you love may have PMDD, don't hesitate to reach out, to learn more, and don't feel like you have to continue to suffer with PMDD each month. You're not alone. You're not crazy. There is a name for this thing. It is real. And there are people out there like me who will understand your experience, who will hold you with compassion and help to get you to a place where you feel more empowered to deal with it. You're not alone. PMDD affects 1 in 20 menstruators. So if any of this has resonated, you very well could be that 1 in 20.
Thank you so much, Melissa Sue Ogden, for sharing your heart with us, your knowledge, your willingness to show up in the world during difficult times. And I'm just really grateful that you spent this hour with us. So thank you very much. And we can find Melissa Sue Ogden on Facebook, on Instagram, on Patreon, and all of them are Yoga for PMDD. Thank you. I have just finished interviewing Melissa Sue Ogden, who has a wonderful business around PMDD. And what I'm really feeling right now as I check in with myself is the beauty of the gender identity of being a woman and all the different phases of our life. Everything from getting our very first menstrual cycle to managing our body, mind, and spirit every month for 30, 40 years in most cases, to the decisions we have to make as women about our health and our health care, to fertility or lack of fertility. George and I, for many, many years, tried to have children and it just didn't happen for us. And that 17-year period, we decided not to go with the IVF and IVI and all of that. But that 17-year period, I was very, very alone, lonely, didn't have people to talk about these types of things with. I wish that I had found a community like Melissa's PMDD community, because I do think for much of my young adulthood, I probably did have some form of PMDD. I just wish I had that community to tune into and to learn about myself, because it was a really rough stretch. And then moving into perimenopause and eventually menopause, these are things that women are not talking to one another about until we get there. And we're like, holy crap, what is happening inside of me? I'm lucky to be surrounded at our yoga therapy school. We have 9 women on the faculty. And a lot of us are in the age group of perimenopause and menopause. And we laugh. We laugh our heads off because we can't remember anything. Our minds are completely fuzzy. We're moody. There's so many things happening inside our bodies. And thankfully, we have each other to laugh with each other and be like, what is going on? We'll stop in mid-sentence and just be like, okay, I have no idea where I was going with that. And the rest of us will laugh. I mean, it's really wonderful to have this group of women. I think there's 10 of us, if I count me, that we can just be together as women and go through this together. And we say that when our husbands pass away before us, we're actually going to live in a community together and support each other through all the rest of the stages of being a woman in this world. And I'm just so appreciative to be in connection with people who want to feel, who want to be at peace in their bodies, with their bodies, their minds, who want to go through these things together. I think that's what life is all about, is that we have other people that we can connect to, that understand us, that honor us. And I think yoga and yoga therapy are such a blessing, because we meet other people who want to do the same, who want to be vulnerable, who want to live deeply. I know as the students come into our yoga therapy school, they don't understand what's about to happen, honestly. The first few months, everyone's on their best behavior and they've got the mask on and they're, going to be a great student and they're going to learn all this information cognitively. And then as we start to go inward and tune inward and do these powerful practices and learn the theory of the gunas, rajas, tamas, sattva, learn about the doshas, things start to break down. And I always say that it's only a natural process of reorganization when things break down, that in order to create a stronger, more stable, more potent, more empathetic, calm, confident version of ourselves, we have to let the old break down before we can rebuild the new person that's going to show up as that confident, potent, loving, kind, empathetic person in the world, stable-minded, open-hearted. It takes time to deconstruct before we reconstruct. And in my mind, that happens over a 2 to 3 year period, which is why our yoga therapy school is 2 to 3 years. And I love that process. It's a little scary. I'm not going to lie and say that when the deconstruction is happening, and not because we try to make it happen, it just happens when you study yoga. that I get a little fearful. I get a little bit like, oh no, they're not going to like this. It's not comfortable. Things have changed. I want to support and hold space, and I do, but even I get a little bit worried about the process sometimes as I see people deconstructing. I know what the end result is going to be. I know they're going to be happier, healthier, whole. I know they're going to be great yoga therapists by the time they graduate, but it's a scary process to allow ourselves to be vulnerable and to break down and to say, look, the life as I know it isn't working. And I need to find a way to manage this body, this mind, this spirit, and maybe the way that society has told us we have to live, just like Melissa said, as producers, you're only as valuable as what you produce. If you fit into this square box that society has created, that's actually very not normal. And in order to try to fit into society's rules and regulations for us, oftentimes we get sick with chronic illness, PMDD, chronic pain, autoimmune diseases. Those are my two areas of specialty, is autoimmune and chronic pain, because I myself have been through that, realizing that trying to fit into what society wanted from me wasn't going to work for me, getting to the point where, wow, I cannot do this anymore. I have to deconstruct my life, my body, my mind, my spirit, as I have been for the first 40 years, and reconstruct in a way that actually is going to allow me to be true to myself, to do the self-care practices that I want to do, to be in deep connection with my husband and my parents and my students and my teachers, to show up in the world that the way that I want to show up. I can't do it the way society is telling me to do it. And I think that's what Melissa was saying too. And I think most people that show up and become yoga therapists, that's why they're here. That's why they're leaving the corporate jobs. That's why they're looking for something different. And that's why they're going to try to build a sustainable yoga business, AKA way of being of service in the world that also offers prana back so that we can eat and have shelter, right? I don't, we have this word business, but as Melissa Sue Ogden said, like, most of us don't go into yoga thinking, I want to be a business person, right? It is a side effect of something that we probably are going to have to do, but we can approach it from a much more holistic perspective, that it's just one more layer of sharing who we are, sharing our gifts, sharing our challenges, being in relationship and connection with one another, that getting out on social media is just an extension of that sharing. So I am going to have a lot to think about today as I work through the rest of my day, honoring myself, honoring my energy, honoring my moods. I got up very early this morning to take care of an ill pet that we have, and I'm going to take a rest today. I'm going to go and lie down and allow myself to settle. I'm going to walk in the woods. I'm going to eat a nice, healthy meal. I already cooked some butternut squash, and I'm going to put it in the Vitamixer with some nice spicy food this morning, and have a little bit of butternut squash spicy soup. I'm going to spend time with my husband. I'm going to let my nervous system and his nervous system come together through multiple hugs today. I'm going to cuddle all of my other pets and slow down and take that 5 minutes to have a cat purring on my lap. I'm going to stand on my deck and admire nature. I'm going to drink tons of water, warm water. I'm going to go to bed by 8:30 tonight. I've already decided it. I'm not going to fill my mind with news and negative things that I really can't impact. I'm going to focus on my work that I'm here to do in the world. So these are all the ways that I'm going to practice self-care today. And I do almost every day. I lift weights and I do an asana practice. And that I couldn't do if I were trying to fit into what society expects from me. And I'm breaking the norm. I'm creating my own new paradigm of how I want to show up in the world. And I hope you will consider doing that too. I know there's a lot of yoga teachers, yoga therapists, and even healthcare providers out there that want the life that I've built for me. You want it for you. And as Melissa said, she's doing it too. I think it's entirely possible. So I leave you with that this morning as I go and drink some hot tea and go do a check-in with my family now. And I'm sending you love and encouraging you to practice self-care and go at your own pace. You don't need to keep up with anybody. All right, have a great day. Thank you for listening to the Yoga Therapy Hour with Amy Wheeler podcast. Another nonprofit organization that we like to support through this podcast is the Krishnamacharya Yoga Mandram in Chennai, India. They are the source for the teachings of the Optimal State Yoga Therapy School, and we are so grateful. The KYM's Mitra division offers free yoga therapy training to a large number of socially and economically underprivileged children and women in Chennai. Feel free to support them through the link listed below on Red Circle, and we also have details on our website, which is also listed below. And finally, a special thank you to our team here at Optimal State. We are truly a global family. George Mantuan, one of our executive producers. Adam Satchel, senior media producer and sound engineer from the Philippines. Krishna Panchal, a producer from Canada. Modupe Abdullahi, who does the show notes and is an editor for us from Nigeria. And Peter Morley, who wrote and produced the music for this show, who lives in Australia. Find more about Peter's work at www.zenmusic.biz. Thank you for listening, and we'll see you next time.